Hi people, welcome back, and let's start with the first of our biomarkers, and that one is, not surprisingly, cortisol. We were introduced to cortisol in the first session that we had together, where we talked about how following the death of a partner, there's a massive rise in cortisol levels immediately after the death, and right up until out to 6 to 8 to 9 months following the death of a life partner, cortisol levels are high. So it's not surprisingly that cortisol pops up as a really significant biomarker for stress, or to indicate allostatic load. So I guess to go through some of the ins and outs of cortisol, on the left there we've got just the normal plot of the cortisol that's released from the adrenal gland over a 24-hour period. Okay, so plasma cortisol, so most of the cortisol that we have in our plasma is bound, so it's protein bound, so not technically active. There's only about 1 to 2% of cortisol that's free in the plasma, and that's the proportion of cortisol that can be active and biologically active. So that's the first point. Second point with cortisol, as you can see on that graph there, there's a huge variation in cortisol levels during the day. They actually peak about 1 to 2 hours following waking up. So you can see there, peak cortisol release occurs between 7:30 and 8 o'clock. So within an hour to 2 hours of waking, and then it slowly declines to about 12 to 18 hours after waking to its lowest levels. And you can see superimposed upon that pattern of highest about 1 to 2 hours following waking, and then lowest 12 to 18 hours following waking, you can see superimposed upon that some pulsatile release patterns. So there's peaks in cortisol. It comes up, comes down, comes up, comes down, comes up, comes down, comes up, comes down. So that's superimposed upon that big rise and then fall during that 24-hour period. And that's because there's pulsatile release coming out of the pituitary, which then drives the pulsatile release of cortisol out of the adrenal glands. Now, I guess the main rider with measuring cortisol and trying to ascertain the levels of stress or allostatic load using cortisol is you can't just measure it once. When you're measuring cortisol levels and you're measuring it in an individual, you must take at least 4 samples of cortisol at 4 different time periods. So that's obviously at waking, before lunch, before dinner, and before going to sleep. Because if you took it once at waking, the level would be quite massive, and you would think, oh my God, this person's got huge cortisol levels and it really needs to come down. They must be really stressed. But in order to get a better picture of the cortisol levels in someone, you really need to take at least 4 samples over about a 24-hour period from waking just through to before sleep. It's about 12 hours, but that's really what you need to be doing if you're going to be using cortisol as a measure of stress. Now, next we've got a systematic review that looked at cortisol levels and their effectiveness at ascertaining whether particular wellness interventions were effective at reducing stress. And I guess this is probably the most important aspects of biomarkers, in that they enable us to measure the effectiveness of an intervention. So that's really where these biomarkers come in as a significant tool for us to use, not in terms of diagnosing whether anyone's stressed or not, but they're very useful at being used to ascertain whether the intervention that you're introducing is actually being effective or not. So this is a systematic review that looked at the effectiveness of a range of mindfulness interventions on cortisol levels in patients. And basically this is a forest plot. So a forest plot basically shows the outcomes of studies and expresses the outcomes as a mean. And if you look on the right hand side, there's a dotted line up from 0. If you don't deviate much from 0, then the intervention wasn't effective. So there wasn't a significant change in the cortisol levels if the dots are not very far from that 0 line. But when they shift significantly to the right or to the left, it means there's been a big change in the cortisol levels as a result of that intervention. So all the dots are shifted to the left, which means there's been a significant reduction overall in all of those studies where they measured cortisol following a particular mindfulness intervention. And those mindfulness interventions were things like meditation, there were stress education interventions, there were walking meditation interventions, transcendental meditation interventions, and they all had a control arm and a study arm, and they basically measured the effectiveness of those interventions at reducing stress by measuring cortisol levels in these patients. Okay, so you can see here that they've used cortisol as a means of measuring the effectiveness of intervention in reducing someone's stress biomarker or allostatic load or stress. Okay. Another interesting one is salivary amylase, believe it or not. Salivary amylase, as we all would have learnt from the digestive system, salivary amylase is an enzyme that's secreted by the parotid gland and is responsible for digesting carbohydrates. Now you might think, what has that got to do with measuring someone's stress or allostatic load? Okay, well, think back. You might remember that saliva production is a function of parasympathetic and sympathetic nerves. And we've normally talked about the function that the parasympathetic nervous system does is increase the rate of production and flow of saliva. But what you may not have remembered is that the sympathetic nervous system is also involved in saliva production, not in its volume, but it is responsible for increasing the release of the actual enzyme from the gland. So when you've got an increase in sympathetic nerve activity, you're going to have an increase in the release of salivary amylase within the saliva itself. So basically, salivary amylase has been used as a surrogate marker of measuring how much sympathetic nerve activity you have been under, or how much sympathetic nerve activity you have, and therefore autonomic stress. In other words, as you increase the level of the sympathetic nervous system in your body, you're also going to see an increase in the amount of salivary amylase in your saliva. Okay, so that's another interesting one. It's often an easier one to use because it quantifies something in the saliva. It's much easier to take a saliva sample than take someone's plasma sample to measure the cortisol content. And this one's an important one, heart rate variability. We talked about this before. There's big changes in heart rate variability in chronic stress. So what is heart rate variability? So basically, heart rate variability, as its name suggests, are trying to quantify the variations in heart rate over time. And that variation in heart rate over time is fundamentally a reflection of the balance that you have between the sympathetic and parasympathetic nervous system. Okay? So essentially we know that as the heart rate increases, it's really a function of a drop in parasympathetic tone and an increase in sympathetic tone. And as the heart rate drops, it's really a function of an increase in parasympathetic tone and a decrease in sympathetic tone. What we need to think about is with heart rate variability, that everything in between the increase and the drop is a measure of the tone that we have between the parasympathetic and sympathetic nervous system. And we can measure that by measuring the RR interval, or the distance between each R wave. If you remember from the ECG, they're the big R waves that are shown on the left. We can measure the time in milliseconds between each R wave, okay? And basically we come up with a time and a frequency domain. We're not going to get into the ins and outs of the time and frequency domain of heart rate variability, but we're just going to skip through and just tell you a little bit about the concepts of heart rate variability and then show you its importance in quantifying stress or allostatic load. So basically heart rate variability is a way in which we can quantify the variability in heart rate, which is a function of the tone between the parasympathetic and sympathetic nervous system. And we do it fundamentally by measuring the distance between the R waves in terms of its time, as shown in that diagram there. Now, the way I like to describe HRV and its significance with respect to the time domain is think about heart rate variability and music. Heart rate variability is thought to be healthy when it's high, so a high heart rate variability. And that's what's shown in that top panel there in panel A. You've got your RR interval in seconds and across time in your x-axis, and there's a high variability of different RR intervals across time in that top panel. In that bottom panel, you've got a much smaller standard deviation, a much lower variation in RR intervals across time, so you tend to have what's called a low heart rate variability. Now, I like to describe those two panels with respect to an analogy with music. Your top panel is more like a classical music symphony, where you've got lots of different fluctuations in rhythm and melody that create that classical music sound. And that's what we want with heart rate variability. We want that high variability in rhythm and in melody. In panel B, that's more like a Depeche Mode song, where you've got this constant driving beat that doesn't fluctuate very much at all throughout the whole song. There's very, very little fluctuation in rhythm and melody with the beat from that type of song as compared to, say, one of Mozart's symphonies. That's the similar concept that we've got to view HRV with respect to the time domain. That we want a high variation in RR intervals, not a low variation in RR intervals. Okay? So that's the time domain. Another significant thing that they look at in HRV is the frequency domain. Now, this gets a little bit technical, but what it basically means, we're still talking about RR intervals, although in heart rate variability circles, the RR interval is designated an NN interval. But let's just, for the sake of simplicity, stick with RR. To get the frequency domain of a heart rate variability, they assign bands of frequency and then count the number of RR intervals that slot into those frequency bands. And they come up with, when you do such a maneuver, you actually come up with two distinct frequency spectrum bands that correspond to the vagal tone and the sympathetic tone innervating, that is a reflection of the sympathetic and parasympathetic tone that's innervating your heart. Okay, so the high frequency spectrum tone is a reflection of the parasympathetic or the vagal tone. The low frequency power spectrum is a reflection of both sympathetic and parasympathetic. And essentially, the frequency domain is then expressed as a ratio of how much low frequency versus high frequency domain or ratio you have. And it reflects the parasympathetic and the sympathetic nervous system ratios. So the easiest way to explain the frequency domain is what happens to your HRV when you're doing a maneuver where you change posture. Now we all know if we're lying down and then we stand up, we have to increase our heart rate quickly to adjust for the change in pressure from becoming horizontal to vertical. So this is the rest and that is the tilt. If you have a look at the rest frequency domain, you can see that there's a roughly equal distribution of low frequency and high frequency domains at rest. But if we then ask that person to stand up or tilt, they have to adapt to that change in posture by increasing their heart rate to adjust for that change in posture that brings about a drop in pressure to their head. So we can see that there's a dramatic increase in the low frequency domain, indicating there's an increase in sympathetic nerves innervating the heart to cause an increase in heart rate, and there's a drop in the proportion of high frequency domain, indicating there's been a drop in parasympathetic activity. So that's a nice little example to explain how HRV has a frequency domain. That tilt demonstration shows you the shift that occurs in parasympathetic to sympathetic ratios, and we can see that with the HRV. So in summary, we have a time domain and a frequency domain. It's important that we have a high heart rate variability in our time domain, and we also want to be looking at equalizing the two frequency domains. We don't want to have a situation where we've got a high low frequency domain versus a low high frequency domain, because that actually reflects a high sympathetic versus parasympathetic ratio. Okay? So, in terms of application, it's been a really powerful clinical application that applies across to diagnosing not only stress, but also a number of other chronic health conditions. Heart rate variability significantly changes in conditions associated with the heart, like congestive heart failure, atrial fibrillation, and conduction abnormalities. You also see significant changes in HRV in diabetic neuropathy, renal failure, sleep disorders, and depression. Okay? So it's not just something that we can use to assess cardiac function and stress, but it's also something that's used clinically to diagnose lots of other particular health conditions, particularly stress and particularly depression. Psychological stress decreases the R interval, so drops your time domain, and increases your LF-HF ratio. So there's a drop in your time domain, decreased heart rate variability, and an increase in the LF-HF ratio, or in other words, an increase in your sympathetic drive. Okay? Other things like smoking, alcohol and medication, diabetes and metabolic syndrome markedly affect heart rate variability. Okay? But one thing to note in all of this, and it was a rider that we talked about with respect to the use of any biomarker, So when you're interpreting someone's HRV, or for instance, any biomarker for stress, whether it be cortisol, whether it be salivary amylase, or whether it be HRV, you must consider the patient's psychological and other medical history as well. So biomarkers shouldn't just be thought of as in isolation to indicate stress. They may in fact be measuring many other things as well. So for instance, you might be looking at someone with renal failure that has a low heart rate variability that's also contributing to the low HRV score because they also may be stressed as well. So very important that you don't look at these biomarkers in isolation. Okay, and in terms of clinical applications, here's a study that's showing you how they've used HRV as a measure of looking at the effectiveness of particular interventions. And in this case, we're looking at yoga practices like meditation, breathing, and looking at HRV changes prior to and post yoga practices like meditation and relaxation. And you can quite clearly see, and I've provided the references there for you, that following meditation in a number of different interventions, you're getting large improvements in HRV. Okay, so you're getting drops in the HF normal, and you're also getting improvements in the HF-LF ratios. So just like cortisol that we showed before, these biomarkers for stress, and in this example HRV, are used as measures to examine the effectiveness of interventions that are related to reducing stress. Okay. Some of the other ones that are used, this is an old one actually, it's appeared in lots of spy movies, and this is one of your classic lie detector responses, and this is your galvanic stress response, and it does relate back to the increasing stress and increasing sweat that happens when someone is under stress. Okay, so the galvanic skin response is actually a machine that measures the conductivity across your skin, which is altered when you increase or decrease your sweat. Okay, so it's an indirect measurement of stress by looking at how your sympathetic nervous system gets activated and can increase your sweat production. So obviously, when we increase our sweat production, it's responsible for changing the conductivity or the electrical conductivity across your skin, and that's what's measured in a galvanic skin response. It's also been referred to as electrodermal activity or your skin conductance response. But it's basically a very, very, very subtle measure of looking at your stress response. Increased stress means increased sweating, and that can be detected very, very subtly by tiny conductance changes measured across the skin with the electrodes that are typically put on your fingers. And it's usually one of these plus an ECG response that integrates HRV that are used in these kind of lie detector machines that we see. And that's our galvanic skin response. Okay, now last slide for this session, and that's this concept of biofeedback. Now we've talked about the biomarkers for stress, that they may be useful to measure how much stress someone is under, but they shouldn't be used in isolation. They are also very useful at measuring the effectiveness of particular interventions in reducing someone's stress. So we saw some examples of where cortisol and where HRV have been used to measure the effectiveness of interventions at reducing someone's stress. They're also quite useful in this concept of biofeedback. Now, what's biofeedback? So it's something that takes a long time to learn. So it's a technique where an individual controls a physiological process that were once thought to be involuntary. So that's things like learning how to control your respiration, learning how to control your heart rate, learning how to control your blood pressure. These are often things that we often think about as being involuntary and not under our control. But with biofeedback, we can start to learn to control them. And biofeedback has been a really important clinical way in which to control a number of things in terms of health: urinary incontinence, anxiety, ADHD, chronic pain, epilepsy, hypertension and motion sickness have all used the biofeedback to clinically reduce the adverse health outcomes associated with those disorders. So they're often non-pharmacological. They're ways in which we can measure things going on in the body, and then we can all somehow try and take control of them. And the common ones that employ biofeedback are the galvanic skin response and HRV. They're often used in biofeedback so that patients can learn when they start to feel stressed. They can actually learn to start to feel the initial changes in skin conductance and the initial changes in heart rate variability that lead on to adverse health events, and they can bring them back and control them before they become adverse health events. So they're very important measures of assisting in controlling the anxiety associated with chronic pain, associated with urinary incontinence and stress, for example, because they actually help train the person understand the initial triggers and their responses to that, and they can then control them and bring the physiological responses back and improve state of mind from there. Okay, people, so that gets us to the end of the biofeedback, the end of the biomarker session. I hope you've enjoyed our quick Cook's tour through the world of biomarkers, and I'll see you later on in the course where we'll talk about things like sleep and nutrition and its relationship to well-being. Bye for now.